patient's chest. When patient's chest is bare, open grey plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the grey case. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters. Keep time with the beat. Pinch nose, tilt head, lift chin, and give 2 full breaths. Breathe. Breathe. Continue with compression.